What does renal failure look like to you, the nurse? Who do you know living with renal failure? Patients with chronic kidney disease, CKD, are best described as having a complex chronic disease with multiple comorbidities. Examples might be diabetes, cardiovascular disease, depression, that require the attention and services to healthcare providers at multiple levels of the healthcare system. Renal failure or kidney failure is also known as chronic kidney disease, CKD. And Matinovic, 2009, states that chronic kidney disease, CKD, is far more prevalent worldwide than was previously assumed. It is estimated that CKD affects approximately 10 to 15% of adults living in the Western countries, with 26 million affected and 20 million at risk of developing CKD. The National Kidney Foundation, 2017, stated, males constitute 57.3% of all new end-stage renal disease, while 262,870 males were on dialysis and 115,306 males were living with a functioning kidney transplant. According to the National Health and Nutrition Survey, 15.1% of females have chronic kidney disease. Once a person has CKD, chances increase of developing cardiovascular disease or death. Diseases that predispose a patient or person to CKD include diabetes, hypertension, and obesity. Close monitoring and routine physical visits from the physician are vital to detecting any of the other disease processes that could predispose patients to the long-term effects of chronic kidney disease. The kidneys in the human body are different than most other tissues and organs in the body. When discussing the pathophysiology of CKD, renal structural and physiological characteristics, as well as the principles of renal tissue injury and repair, should be taken into consideration. A variety of changes can impact the kidney's ability to function properly, with resulting impeded kidney function. The kidneys require much more perfusion per minute than other important organs such as the liver, heart, and brain. This extra required perfusion could predispose the kidneys to increased amounts of toxins and disease pathogens. Secondly, glomerular filtration is dependent on rather high intra and transglomerular pressure, even under physiological conditions, rendering the glomerular capillaries vulnerable to hemodynamic injury, in contrast to other capillary beds. Thirdly, the protective barrier of the glomerular filtration system can be violated and proteins can infiltrate the renal system and do damage. The nephrons and the glomerulus are both separate functioning units, and any disruption in either system can bring on renal problems and, if left untreated, can result in chronic kidney disease. Matinovic stated that the main causes of renal injury are based on immunologic reactions, tissue hypoxia and ischemia, exogenic agents like drugs, endogenous substances like glucose or paraproteins, and genetic defects. The kidneys can become fibrotic after injury as a result of the inflammation. Signs and symptoms of chronic kidney disease can be varied and depending upon the cause of the malfunction. Chronic renal failure is a progressive disease characterized by an increasing inability of the kidneys to maintain normally low levels of the products of protein metabolism, normal blood pressure, hematocrit, sodium, water, potassium, and acid base. Signs and symptoms of CKD from lifeoptions.org 2018 are fixed proteinuria, elevated BUN and creatinine, metabolic acidosis, hypertension, heart failure and other cardiac vascular events, anorexia and morning vomiting, pruritus, and uremic coagulopathy. Slide 5 lists the classifications of the severity of chronic kidney disease. Stage 1 reveals a patient can have a kidney damage and still retain above normal glomerular filtration rates. But as the disease progresses through the stages, if not halted, CKD can lead to renal failure, uremia, and dialysis. Chronic kidney disease, like other comorbidities, can strike across cultures and nationalities. Who's more likely to get chronic kidney disease? Well, African Americans have a 4-to-1 ratio of developing CKD compared to whites. African Americans account for 35% of cases in the United States. Hispanics have seen the number of family members diagnosed with CKD rise 70% since 2000. And American Indians and Alaskan Natives are 1.2 times more likely to be diagnosed with CKD. Early detection is one of the best ways to prevent CKD. Changes in renal function may go unnoticed, even with occasional blood work, if the healthcare provider and patient aren't looking for potential problems. Often, physicians collect extensive cardiac health history information if a patient has had family history of heart disease, but rarely is family history of kidney disease mentioned by patients. Chronic kidney disease noted in a family history needs to get the same attention other genetic-based diseases get. Healthcare personnel should go as far as asking specifically about a history of renal issues. Patients tend to skip over renal concerns, assuming they aren't as dangerous as a heart attack, right? Tests for diagnosing CKD include routine kidney function tests, and such as lab work or urinalysis checking for abnormalities in the BUN and creatinine. A kidney ultrasound or biopsy might indicate a potential problem. As always, patients reporting symptoms at the earliest onset gives physicians an opportunity to get ahead of the problems that may lay ahead if left untreated. There are ways patients can promote health before the renal disease process begins. Clark and Paraska, 2014, state the importance of getting adequate sunlight, using aromatherapy to reduce stress, exercise, basil leaf extract, milk thistle, eating garlic, avoiding high intake of animal protein and carbonated beverages, drinking green tea while eating a diet high in vegetables, legumes, nuts, whole grains, and fish. Many of these health promotion ideas should incorporate the expertise and training of the patient's healthcare physician. The key to success of these health promotion ideas, whether for a patient free from illness or one with a new diagnosis, is the important role of self-management and personal care. Unless a patient is motivated and desires to see improvements of potential wellness in their chronic physical ailment, self-management will be unsuccessful. Ong et al. 2013 defines self-management as participating in education or treatment designed to bring about specific outcomes, preparing people to manage their health condition on a day-to-day basis, practicing specific behaviors, and having the skills and abilities to reduce the physical and emotional impact of the illness with or without collaboration of the healthcare team. Some roadblocks to compliance to treatment are complex treatment programs that chronic kidney disease often requires. A patient struggling with CKD can be taking 15 medications daily on average. The cost and the medications plus the time and lifestyle changes this involves can sometimes just seem too daunting. Health resources are smaller than the need. An eventual non-adherence to treatment programs. Often patients with a new diagnosis often feel extremely overwhelmed and may feel very uninvolved as caregivers assist and physicians prescribe the usual protocol for CKD. Strategies that improve patient self-management include involve the patient in the healthcare process through giving opportunity for questions, allow the patient to be the decision maker, show respect to the patient, treating him as a person rather than treating the disease like a person, with the focus being completely upon the disease process. Promote healthcare team collaboration by communicating vital information through the active use of the health electronic record between facilities. Offer educational opportunities to learn more about the disease and empower the patient with information and hands-on training if necessary for the patient to receive better outcomes in his situation. And lastly, offer emotional support through active listening and information about resources such as the National Kidney Foundation and the support groups located in the community. In conclusion, chronic renal patients on hemodialysis programs experience a radical change in their lives, such as the use of catheters, water restrictions, changes in diet, and self-image, among other changes. In slide 9, we see the pieces of the puzzle for successful self-management. Each piece, though appearing simple, is valuable to the entire puzzle, taking on the characteristic and shape of the successful picture that was intended. So it is with patients diagnosed with chronic kidney disease. To have a working self-management program, each piece of the puzzle must involve the support of family, friends, healthcare providers, community resources, education, and the patient's own sense of motivation to be truly life-giving and successful.